Today's big discussion is going to be all about ASIIS. We're excited that ADHS, Maggie Macias from ADHS will be able to provide answer all your questions about ASIIS, or if not, give you instructions on how to get them answered afterwards. So we have sadly lost 98 more people due to COVID-19 in the last week, bringing our total death toll from the pandemic to 17,221 people in Arizona. Our case count does continue to slightly tick up. Again, we're not surprised about that, but also remember to keep wearing our masks, tell your patients to wear their masks, and continue socially distancing, practicing good hand hygiene. Our total cases are about 856,000 cases through the pandemic. And we have administered 4,649,000 vaccines. Half of Arizonans now have at least one dose working, building immunity in their systems, which is a really great thing. Not too much has changed since last week. Johnson & Johnson is still on pause. ASIP is going to meet tomorrow, and we are all hoping to get a recommendation. They've been very busy looking at all of that scientific data. Tomorrow, ASIP will decide whether to continue with the pause, or will tell us and the providers throughout the nation that you can start administering Johnson & Johnson again. We do expect that if that happens, it might be a different screening questionnaire, so we'll be sure to send all of that information out to you or address it next week. We continue to get questions about Pfizer. Remember, Pfizer is only for 16 and up right now, but we are curious. The last couple of weeks we've been saying, call in your teens to try and catch them up on the other ASIP recommended vaccines. And I'm launching a poll here that we hope that you'll answer. We're wondering, what do your adolescent coverage rates look like right now? And we're thinking about ASIP recommended vaccines, not COVID vaccines. So if you're running reports, are they about the same as they have been? Do you think that they have decreased? Are they increasing? We're just kind of curious. So I'll give you a couple seconds here. And if you're saying that they decreased, we'd love if you could chat in about by how much. Like, is this a huge drop that you're seeing, or is it something that you think you'll be able to pick up in the next few months? We'll give you maybe 10 more seconds here. All right. So you see the results there on your screen. We do know a lot of you that log on to these are COVID vaccine providers helping us through the pandemic, but don't provide regular well care services to kids. We are really glad to see that it looks like about a third of you are saying no change this year. It's about the same, but there are still some saying that your rates have decreased. And again, would love if you could chat in by how much have they decreased. As we prepare for, once ASIP is finished reviewing all of the data for Johnson & Johnson, they'll be refocused on that Pfizer data for children ages 12 to 16 for the Pfizer vaccine. And we're hearing that it might be like 3 weeks that we are able to start going down to 12 years old. Right now, you have to wait 2 weeks between a Pfizer dose and any other vaccine. So if you start calling those folks in, but it is good to see that it doesn't seem like it's everyone seeing a huge decrease. If there's anything we can do, or you need ideas about how to increase your rates, please let us know. We have lots of resources for a reminder recall, and just have been collecting kind of best practices throughout the years from primary care sites that administer vaccines to teens. So. All right, well, I'm going to stop sharing my screen and let Maggie bring hers up to talk with us about ASIIS. So for those of you who were on about 6 weeks ago, a lot of this might be repeat or a refresher of the common pitfalls for ASIIS. But we know a lot of you are onboarded and activated and now actually giving vaccines. So we want to make sure that you kind of see this presentation with new eyes and get all of your questions answered. So go ahead, Maggie, and take it away.
Okay, just want to verify you guys can see my screen.
Yep, we see you.
Awesome. All right, my name is Maggie and I work with ASIIS. I am the ASIIS Enhancement Support Specialist at the Arizona Department of Health Services. So today I'm just going to take you over some important information about ASIIS. So we get the common question, when will we be able to place orders in ASIIS? At the time being, right now, if you need to place orders of COVID, please contact your county health departments. We don't have a current timeline of when we will move into phase 2 to allow you to place your orders directly into ASIIS. What is ASIIS? ASIIS is our state immunization database used to record and administer doses and track vaccine inventory. So regardless of what system you use to document vaccines administered, either your EHR, your VMS, or ASIIS, you need to account for all your doses. If you are using a EHR versus direct data entry into ASIIS, you'll have a different experience. For the HL7 providers or who have EHRs or EMRs and are sending the information via HL7, in order to have a successful HL7 data transfer, you need to make sure that you're sending the correct funding source, which is PAN, VFC eligibility, non-VFC eligible, vaccine code, NDC from the box, or CVX or CPT code, manufacturer code from the box, lot number information from the box, not the vial, as well facility ID. This is more for the EHR vendors. When you're sending the information over to ASIIS, make sure that you're sending the correct ID for that facility so that it decrements properly. For the actual staff, when you're in your EHR, just make sure that you're logged into the correct facility, you're sending over the correct information for that specific inventory, that specific facility. As well, we do see that providers send over unknown, missing, or incorrect fields. You should not be sending typically unknown. You should know the patient that you're sending the information over to ASIIS. So again, everything needs to mirror exactly how it is in ASIIS to what is in your EHR. The funding source, once again, I want to emphasize this, make sure that you are sending PAN. On the front end, typically in your EHR system, you'll see some EHR systems have availability of PAN. If you don't have that available, just make sure that your EHR vendor on the back end is mapping it to the correct CVX code, which the CVX code should be VXC50. And again, if you need more information on this, we'll go ahead and put it in the chat there for you. The specific link here. If you send the incorrect funding source, it will not decrement properly from your ASIIS inventory. So again, it's very important that you send the correct funding source. When you receive your vaccines in your clinics, make sure that you are going directly into ASIIS and receiving the doses immediately in ASIIS. You'll want to make sure that you log into ASIIS, go to orders and transfers, create view orders, and select the inbound orders, verify the information, and select receive. I know in our previous presentation, it was asked to have more of a detail by step how to receive the order. So on my next slides, I'll go ahead and cover how to receive the orders in more detail. You want to select the Orders Transfer tab, select the Create View Orders tab on the left-hand side of ASIIS here. You'll go into the inbound orders, select the arrow. You'll enter the receipt quantity, meaning physically what you got on hand for vaccines. Once you enter the received quantity, then you'll hit the Receive button located on the right-hand side of ASIIS. Expiration dates. ASIIS may show 2069 as a placeholder, and you must change it when you're marking the doses received in ASIIS. Again, you want to make sure everything that's on the box mirrors what is in ASIIS. You want to make sure the quantity that you received is exact amount in here. You want to make sure the vaccine name is correct, the funding source, the manufacturer code, lot number, and expiration date. Now for Moderna, how to look up the vial expiration date, here's a link here that will add it to the chat. And you can go ahead and find that information specifically for Moderna. Once you verify all your information, you want to make sure you select the Receive button located on the right-hand side of ASIIS. Again, if you don't receive your doses in ASIIS, this is very important. Your doses may not decrement from your ASIIS inventory, or not may, but they will not decrement. You'll have to give us a call immediately and we can give you further assistance. The ASIIS help desk email, I can provide it in the right-hand side of the chat as well. If you start administering your doses to your patients and you forgot to receive them, again, please give us a call or email us letting us know of this error. I did want to go over some common errors that we do see when typing in the information or verifying that information on this previous screen here that we just discussed here. We see a lot of errors, 5 or S, yes, it looks very common, 2 and Z, 4 or A, G or 6, 1 or I, 0 or O. So transpose numbers and letters. So just make sure that you're verifying, you're training your staff that they are looking at that information on the box and that it's being mirrored exactly and entered into ASIIS as it is in your EHR. So we have some helpful resources to troubleshoot issues. We have ASIIS reports, which are called patient detail report. This report can show you the doses that didn't decrement. Lot usage and recall report, it can show you the doses that decremented. When you run these reports, you can compare them to your ASIIS reports, you can compare them to your dose accountability logs or your EMR data. If you don't have dose accountability logs, we can provide some at ADHS. You can go ahead and email us at the ASIIS help desk and we're more than happy to guide you where those accountability logs are. Some EMRs do produce dose accountability logs, but if they don't, that's okay. We're more than happy to provide our dose accountability logs to assist you. Let's go over the patient detail report. So the patient detail report, I'm going to explain how you can create this report in an Excel format first. You want to go ahead and select by service, vaccination date range. You don't want to run the report more than 30 months. It will time out. ASIIS will slow down, so no more than 30 months, no more than 30 days. Select active and inactive, select all, and you'll export your report. Some people prefer Excel so they can filter easily through the report. And here's an example of a Excel format. As you can see here, we can see the manufacturer codes, the lot numbers, the funding source, eligibility, if it's historical, if it decremented, the vaccination date, the type of vaccine that was given, and the information of the patient. As you can see here, if I point out NOV stands for Novartis, but Novartis dose does not make a rotavirus vaccine. So the vaccine type is pentavalent. So the correct manufacturer code that should have been sent over was actually MSD. But as you can see, I'm sorry about that. So yes, the incorrect information was sent incorrectly here. So again, you want to make sure you're sending your correct manufacturer codes, and you don't want to be sending unknown. You should know the manufacturer code. It's located on the box again. Here's the patient detail report now, created as a PDF format. Here's the common thing that we see daily regarding COVID-19 vaccines. We're missing the funding source or wrong funding source. And here it will tell you, no, it did not decrement. And here we would be able to see, why didn't it decrement? It's missing the funding source. And this is just an example of sometimes missing. Sometimes here we'll have something completely different. It would be private or VFC. And of course, VFC is not going to decrement from this vaccine. Mindful in training the staff and letting them know, let's just make sure we're selecting the correct funding source in our EMR so that our vaccines decrement properly. The lot usage and recall report. It's located under the state reports tab. You want to select lot usage and recall report.
Oops.
You want to make sure you select the vaccine that is in question. Once you select the vaccine, you'll select the arrow and it will move it to the right-hand side, and you will select create report. This is the lot usage and recall report here. Let's go ahead and look at it a little bit more closely. Even though it shows doses that decremented, it can sometimes give us some clues of issues we may have. For example, here we have Pooh Bear Honey received a double dose. Is this accurate? It makes me think, well, most of my patients receive full doses. Why did Honey Pooh Bear receive double dose? So this just makes you question. Let me just double check if this information is correct, and I'll go into ASIIS. And again, we're just looking for clues to make sure if this information that we're entering is accurate. The lot usage and recall report will also show you the total of patients here and the total that got administered. So as you can see here in my example, Minnie Mouse received 2 doses 1 day apart. This makes me question again, is this accurate? Did she really like that vaccine that she came back twice for HPV-9? So this is where you question. Let me go double check my dose accountability logs, my EMR logs, and compare them to ASIIS. And here is my example. Here is my dose accountability log on my right-hand side. I pull it up against my lot usage and recall report here, and I'll compare it. As you can see here, I have Buzz Lightyear, but Buzz and Briar are on my dose accountability log. I gave them the dose, but as you can see, Buzz and Briar are not on the lot usage and recall report. This is where I would go back into ASIIS and correct this issue, as well with Minnie Mouse on this dose accountability log. I see her here twice, but I only see her once. And here's the link where you can actually find the dose accountability logs or the log tracking log, depending on how you feel comfortable logging the information. These two are great resources to help you account for your doses and try to limit less errors in ASIIS. Correcting negative doses in ASIIS. This is for Pfizer vaccines on prior to February 15th. If you see that you have negative doses in ASIIS for COVID-19 vaccines specifically, again, just for your COVID-19 vaccines, go ahead and follow this link that's located in the chat that will direct you on how to create how to correct negative doses in ASIIS. You'll want to make sure that you're setting up your data loggers prior to receiving your vaccines in ASIIS. You don't want to be caught with receiving your vaccines and not having your data logger set up. So please set up your data loggers and make sure you have data loggers. If you don't have data loggers or you're not familiar on how to set it up, Arizona VOC at azdhs.gov. You'll want to download every 2 weeks and send report every month with each order to the email address arizonavfc at azdhs.gov. This must be in data format. PDF is not a data format. You may submit directly from your LagTog application. Again, if you do not email your data loggers with your orders, your order may be canceled. Here's a helpful tip. I usually tell my providers, go back to the email that you last sent Arizona VFC, and in that subject line, if you put the date of when was the last time you submitted your information from that day to the current day that you're going to place your order, that's the information you should be sending to the Arizona VFC. And in that subject line in the email, you can put, your dates and your PIN number. Again, thank you very much for your time today. If you have any questions, please feel free to either email us or call us directly out of the main line. And if you have questions now, please feel free to either unmute yourself or put them in the chat. Thank you.
Thanks, Maggie.
Is there a recording of this somewhere, like if we want to reference back to the training?
We will post it on the TAPI website, and then we'll email you the link. I think it goes out on Monday, the link of where the recordings are. So you can bookmark it Monday.
Thank you.
Hi, this is Leticia from Mountain Park Health Center. I have a question. And I don't know if you may be able to answer this question or if you have any other practices, but we just recently enabled the bidirectional interface with our EMR, and we currently use ECW. And in testing, as we were generating the public health record to pull the data that was in the ASIIS registry into our patient's chart, and as we were trying to import the historical vaccines that were administered elsewhere, we came across a few examples where in the ASIIS registry, there was multiple patients that potentially matched the patient that we were trying to link from the ASIIS registry. Now, I don't know if this is related to our EMR or if you have any idea how it would work, but the specific example that I had said that in the ASIIS registry, I had 3 patients that potentially matched my patient. Now, if I selected one and I clicked that I wanted to submit that patient and retrieve the information from ASIIS, that once I linked it, I was not able to unlink it. So my question would be, if we did that and we by accident linked the incorrect patient from the ASIIS registry to this patient, as this patient gets additional vaccines, would they import into this patient's record that I linked, or would it go to the patient's record, whatever they already have with ASIIS? I don't know if that makes sense.
Yes, so technically ASIIS is telling you that there's a duplicate, there could be a duplicate match.
Correct.
So this is more in depth question. So I would like to take your email, and
Okay.
that way I could explain to you more on one-to-one.
Okay. Do you want me to put it on the chat?
Yes, please.
Okay, I will do that now. Thank you so much.
You're welcome.
Maggie, we had a question come in on the chat asking, how do you fix it when something's input twice?
So whoever administered that vaccine that if that specific facility administered that vaccine twice, they will have to go and remove that vaccine from the patient's record, one of them. If they did not administer that vaccine, they can actually contact the ASIIS help desk. So that way ASIIS help desk can contact that provider and let them know that they entered a second vaccine incorrectly into a patient's record.
So whoever put that in, if you have any follow-up questions, you can put them in the chat or unmute yourself.
So my name is Josephine. I'm with North Country Healthcare in Cholo. So on a couple occasions, I've had patients come in.
I'm sorry, am I the only one? I can't hear the question. It's really
Yeah.
low.
You're kind of low. Is there a way you can get closer to your mic or? We still can't hear you. Well, see if you can maybe, I don't know, see if you can repair that, or I think I saw you chatting in there too, if you wanted to type something longer and we can read it up. Sorry. We had another question on the chat about how do you clear up when it states that a patient has gotten a third dose? Is that the same answer?
Yes.
Okay.
Hi, this is Alva with St. Vincent de Paul Medical. I'm sorry, it got cut out just a little bit in between your guys' Zoom, but if we had to go back in and correct because the wrong lot or not NDC or NCD number was placed, we would need to go back into our EHR to correct that number. Is that correct?
Yes, you can just resend the vaccine. It will just update in ASIIS. It won't do a double entry.
Okay. And then my nurses are just wondering, is there a reason why it's the NDC on the box versus the ones on the vials, or is this just happened to be one of those tedious things?
It's always been, as far as I can remember, it's always the information located on the box for vaccines, not the vial. They're different. I know there's a specific reason, but if you leave your email, we can give you a specific reasoning when we locate it, but I just know that it's always been the information located on the box, not the vials.
Okay, thank you. They're just asking me, ask this very important question. I'm like, okay, I will. But I'll make sure to correct our information for the box number from ones that we didn't enter in correctly. Thank you.
No problem.
And this is Jennifer. I can kind of add to that a little bit. The CDC can only track by the number that's on the box. So when they send them out to providers and to states, they only have the box number because they can't open the box to see what the vials are. So if the best practice is to collect that box number, we've been working with all of the insurance companies to make sure that they pay the claims based on the box number and not the vial. Though you all are used to doing the vial for insurance claims, most of the health plans have said they'll pay it based on that box NDC code.
And
Thank
Meg,
you.
we did get another follow-up question around fixing when it's input twice. Is that something that you have screenshots for about how to do that, or is that already on IPO-Train that we can send out to everybody?
I'm pretty sure there has to be something on IPO-Train regarding removing a vaccine. It's the same. I sent the last link to, I believe, to Roxanne.
Okay.
About editing the patient's record and adding the vaccines manually. It's the same format.
Okay, so we'll be sure to highlight that when we send out the follow-up for folks asking about for further instruction or visuals for that. We have another question saying they are having a problem with race showing up in ASIIS for unknown race or unable to report due to policy law. In ASIIS, there's no option to select those. Can you help?
If we can take down your email, we'll go ahead and make sure we send you our HL7 VXU information, and we can troubleshoot together to see what we can come up with.
Thank you. So just go ahead and put your email in there. Our EHR provider doesn't seem to properly update ASIIS with vaccines we enter in. Is there a way to directly input COVID vaccines into the ASIIS system?
We have a helpful document. It's called Arizona HL7 Specific Rules version 2.51 that I believe we have the link here directly that we can add. And you can provide that to your EHR vendor and let them know specifically the rules that we require for COVID-19 vaccines and see if that helps.
In your experience, what's the turnaround for an EHR vendor to actually be able to dump that data in there?
They're pretty quick.
Practice reaches out to them.
They're actually pretty quick. I communicate with EHR vendors on a day-to-day basis, and if I send something to them, they probably reply within 1 to 2 days.
Okay, good. And then in the meantime, too, we can make sure to repost the resources for entering manually. You can enter everything into ASIIS manually, so we'll send those resources out as well. So Josephine chatted in her question. So I have a few cases where it shows a patient has gotten a dose at a different location. When I reach out to the other location to get it corrected on their end, can I just email you to get this fixed? And I guess instead of working with the other organization.
Right. Some organizations, I guess they're not wanting to work with her. So I would just email the help desk directly and let them know of the situation, and they're more than happy to help you guys.
Okay.
Can I add to that too, Maggie? This is Angela.
Hi, Angela. Of course.
Sometimes it puts us in a pickle because we didn't administer the vaccine to the patient. So it needs to be the person who added the data to ASIIS who corrects it. So it is a pickle whenever the person doesn't want to communicate with them, but we can, if you were to call us, we would be able to call the other provider and then they would be able to fix it. So something I like when I hear some of our ASIIS managers say is ASIIS is just a repository that holds the data. So we may think something looks odd too, but ASIIS is just holding the data. And so it's really up to the providers who enter the data to make sure that it's accurate. And if it's not accurate, to edit it. Thanks.
Thank you, Angela.
And what are some common reasons why an order would be denied? I know that the counties are allocating a little bit more, but do you all know of any common reasons why that would happen?
Angela, is it more like temperature excursions?
Yeah, I can say the ones that I've seen this week. This week, orders may be, even though the county may want to allocate to a provider, it may be denied because the provider has open temperature excursions. So perhaps their refrigerator or their freezer had out of range temperatures. So they would need to get that resolved and provide us the vaccine incident report and their data logger data information before they're able to order vaccines. Another thing that I've seen a couple times this week is the CMO or CMO, CEO, and signatory physician will have left the practice. And so they signed as the medical person responsible for the COVID-19 vaccines. The COVID-19 vaccines are under them. And if they leave the practice and we're notified, and we're not always directly notified by the provider, sometimes it's a third-party source that notifies us. But when we're notified, we have to make that account inactive until we have a signatory physician. You know, you've got to have somebody with a license there who can prescribe the vaccines. And so we would sometimes inactivate a provider if their key staff members have changed. And then once we get the new signatory physician to sign the CDC agreement, then they can be made active again. those are the two things that come to my head. I'm sure there are other little quirks that come about, but those are the two that I've seen this week.
Thanks. And then we had a question earlier. Are they required to lock their fridges?
I don't think the refrigerator unit itself needs to have a lock, but the building needs to be a secure building. It needs to be a building with 4 walls. It can't be like a tent or something. You need to have an actual physical building, and the building itself needs to be locked. Some providers do lock their refrigerators and freezers, but that piece isn't a requirement.
Okay, thanks. And Jen, I don't know if this is an ADHS or a clinician question about the Moderna, using those extra doses in the Moderna. Did you see that one in the chat?
I did. I know that they've submitted. I don't know that it's been approved yet for their additional dose. But the second part of that question was, how do they adjust the inventory if it goes into the negative for Moderna? Would be Maggie and Angela. And I'm going to keep trying to see if I can get a date for when they think that could be approved.
Thank you.
So are you talking about the Moderna going to 14 dose vials?
Yeah, so the question.
No, it's the extra dose that they get out.
Okay. So right now, Moderna is a 10 dose vial, and you can sometimes get an 11th dose out of it. And it is in the EUA that they can get that 11th dose. So they're fine to get the 11th dose out as long as it's a full dose and as long as they're not pooling from multiple vials, right? You can't pool from multiple vials. So if you can get a full 11th dose, then you can. You're right, it may make your ASIIS inventory go in the negative to administer an extra dose. We do have a training flyer on that will show you how to make that adjustment in your ASIIS inventory so that you can show that those extra negative doses were legitimately given. Coming soon, the Moderna vials, it will be like the same vial. It will look the same, but they're just allowing Moderna to fill the vial with more liquid. So the CDC says the vials will get 13 to 15 doses out. So it's a range. So when we order, we'll order based on 14 doses being in the multi-dose vial. And in ASIIS, your ASIIS will show 14 doses in that multi-dose vial. But Moderna says you may be able to get 13. Sometimes you may be able to get 15. It's kind of a range. I think it depends on the type of needles that you have and how you draw it out. But that will, if people consistently get 15 doses out of that 14 dose vial, it would for sure make it go negative. And if you only get 13 doses out of that 14 dose vial, then it may appear that you are short some. So that is an issue we are aware of and working with, and I'll be quiet in case Maggie wants to add some more.
No, you did great. That was awesome.
So we have oh, go ahead, Jen.
Yeah, I had a question I was just getting ready to answer, but then I thought, well, I better check because they have a patient in Mexico, so they can't put the address in. And this has come up a few times, even with people who don't want to share their address or who are homeless. And the CDC says to go ahead and put the clinic's address in, of where you're doing the clinic, whether you're at the homeless shelter or your office. But does ASIIS take that? Because we heard a couple of weeks ago that ASIIS was rejecting those that had the clinic's address.
I haven't seen the rejection in the messages in the vaccines that are coming over. We don't have it set up like that on the back end.
Okay,
so.
perfect. So that
Go
could have
ahead,
been
Angela.
something different. So
I think where the
Angela?
problem comes in is ASIIS will put some of those patients in the manual deduplication, Maggie.
Oh, and it takes longer
That they're
for
the
them.
same person,
Right.
especially if they have a common name. If your name's John Smith and you've got a couple John Smiths and they're having that clinic address, I know we have had some clinics that have submitted all the clinic address. And so all of those patients, you know, ASIIS thought they were all the same person. So if it's possible, I would try to get an address, you know, next of kin or something for them. Another issue with putting the clinic address is if the patient were to use MyIR or try to get a copy of their immunizations, hopefully their name and birthday is correct, but another way that we match people is by address. So I would try to get an address that the person is familiar with, next of kin, something. If you absolutely don't have it, then you can put the clinic address. You would just want to make sure that all the other pieces of information that you're sending over, the name and the birthday, are exact, because if there happens to be an error in the birthday or name and the address is the clinic address, that can just throw the system off into thinking that they're the same person, and they're not.
Anybody else have ASIIS stuff? I see in the chat, there's a couple of things that would probably be good, just kind of rapid fire discussions that we can all have and give some ideas about how to get patients in for appointments and what to do with wasted doses. But what other final questions do you have specific about ASIIS? And you can just
We
go
have
ahead.
some follow-up on exactly where the instructions are for decrementing that negative inventory dose, and then an explanation, a little bit more of an explanation of data logger and temps. So do you have a link to those? And one of the links I had, it says it's been moved. So we will follow up with those afterwards too, to make sure that you have the most up-to-date locations of documents.
Hi, this is Alva again. I had a question. When we put in our, and I think it may have been covered, but we have, we don't have an option when we put in the order group into our electronic health record to put in the facility code that we have for vaccinations. There doesn't seem to be a place for it. How would we go about resolving this, or would I need to just email help desk specifically?
I'm sorry, I didn't catch that question. Can you repeat that? I apologize.
Yeah, no worries. I have, we've been entering in our orders for the Moderna vaccine, and we don't have a place to put in our facility ID for the vaccinations. And so it's not indicating on ASIIS that it's from our facility, although we can see it on ASIIS that it's in there. And so how do we go about making sure that we input that if that's not an option in our EHR order?
I'm a little confused with this question. Where exactly, Angela, do you understand this question? Because I thought once they receive it, they see it in ASIIS. So we would have to, I'm guessing we would have to troubleshoot. I would have to troubleshoot and see where exactly the issue is at.
Yeah, I mean, I see it in ASIIS. I just, when I click onto the patient's patients that to verify that it was entered in correctly, it doesn't, it has, it shows on theirs, it shows like in blue highlight with the little star that vaccines that were given at our facility versus none, and they're not.
Okay, so that sounds to me like it's not EHR to ASIIS, which is not decrementing and not linking to the patient's record. So I can take a look at that. If you email the ASIIS group 1 email, okay, and I can look into your inventory and see.
All right, thank you. I mean, I already emailed, but thank you. Yeah, I'll definitely make sure to follow up on that.
Okay, thank you.
And there's a clarifying question in the chat too. Do we need to send in data loggers with the orders? They already placed their orders yesterday and didn't send the data loggers in with the order for COVID vaccine, not VFC.
So I can help answer this. This is Angela. So for COVID-19 vaccines, you do not have to submit your data logger reports with your order at this time. In the future, you may need to, but not at this time. At this time, you will just hold on to your data logger reports, keep them for 6 years. You'll still download them every 2 weeks and review them to make sure there's no out of range temperatures. And then just keep them on file. We will randomly ask providers for their data logger reports. So if you get an email saying that you are randomly chosen for data logger report review, then you would need to submit those reports to us. If you have not received that email asking for them, then just hang tight, hold on to them. This may change in the future, but that's what it is for right now.
I think she's very happy to hear that. Okay, so you do need, everyone does need to submit all of those doses into ASIIS within 24 hours. There's a corrected link in the chat showing the reporting requirements so that if you know your EHR will not communicate to ASIIS, then you know what you need to make sure that you collect so you can get it manually entered within, that night. And if you continue to have ASIIS questions, go ahead and throw them in the chat. But there were a couple other things I was hoping people could get some good ideas on. And this first one, Maggie and Angela, you might even be able to weigh in on what are tips on keeping those fridges stabilized so that they can avoid any temperature excursions? And anybody unmute if you have ideas for that practice.
This is Angela. So I've heard the more water bottles, the merrier. So if you are not allowed to put vaccines on that bottom shelf of the refrigerator. So if you just get some gallon water bottle jugs and fill those in the bottom, I've heard that really works with some providers, or even lining the back of the fridge because the vaccines can't touch the back of the fridge. So if you line that with water bottles too, water bottles help keep the temperature stable within the refrigerator. Another thing I would think to look at would be to look at your data logger and make sure that your data logger is the appropriate kind with a probe and a buffered solution. If your data logger is just a sensor that's measuring air temperature, then every time you open and close the door, you may get a fluctuation if it's measuring air temperature. One of the data logger requirements is that the data logger is a probe and a buffered solution, but you just might want to check yours and make sure that that probe isn't broken or something didn't happen to it.
And be sure to label those right on those bottles, do not drink, because in August in Phoenix, they will all go missing. So, and Stacy's chatting in there, do not put water bottles in the fridge warm or hot. Yeah, that's a really good tip too. Anybody else have anything? Remember too, as you're preparing for storm season, monsoon season, make sure that people know that in the event of a power outage if it's really brief, do not open that fridge. So make sure that people remember that too. There's a lot of people who've been asking us, how are you getting people signed up for vaccines? So I wonder if we can dig in a little bit deeper about this next week, but anybody have things off the top of your head that you've done in the last week that are really helping people make appointments for vaccines? taking flyers around to local businesses. That's good. We've also heard people have called like the neighborhood restaurants and things, which does require being open sometimes till like 7 p.m. staying if you already have those hours, but. A frame sign saying COVID vaccines, that's a great idea to put, I assume on the street or in your office window or something like that for folks walking by. Have your HR send out an email to all your staff offering vaccines to their families. There have been questions that have popped up over the last few weeks about, do you offer vaccines to non-patients? And it sounds like most people do if they have them right there in front of them. They are offering those. Calling local pharmacies to see if they have waiting lists. Yeah, I mean, it's a lot of posters, huh? There's some things on Vaccine Finder as well in the popping up in the chat here. So, Jen, what have you learned about that, about not getting the things on Vaccine Finder? Like when they don't show
The
up,
troubles?
it doesn't show up, yeah.
You know, I haven't, and I was just trying to figure out, and there's two vaccine finders, so that gets confusing as well. There's a national vaccine finder where you report the number of doses that you do every day, and you can post your clinic as an open clinic. And then there's ADHS's vaccine finder where you can also post your clinics. And then I think you can work with your county if they are keeping a website of locations, you can ask them to post them there as well, if you plan to have an open clinic. So I don't know why they're rejecting the CSV file. Maybe Angela knows. Do you know anything, Angela?
I don't. They do. The CDC does have strict requirements, so it may be that just one column in your CSV file is off or not labeled correctly, and it will reject the entire file. If you give me a minute, I can Google the Vaccine Finder resource page, and I know on the resource page they have a document that will have all of the requirements that it should have. Also on the CDC Vaccine Finder resource page, they have a contact link, so you could always contact them and they can help you troubleshoot why your CSV file is being rejected. For those of you who upload your CSV file, I think you may have to put something in the file to let them know that you want to be visible to the public. And then for those of you who log into CDC Vaccine Finder and just physically report in there, then there's a switch that you can select to make your site be visible on CDC Vaccine Finder. If you go make it visible, whatever change you make today will start at 7 a.m. I think it's Eastern time tomorrow. But let me go find that link for you.
And are they submitting each event, or is it, if it's a private practice and they want to be able to just offer some slots for walk-ins who would want it, you know, after 2 or something, or do they have the ability to do that?
I think they do have the ability to make some comments. I don't think they're able to just blanket,
Okay.
like say we have X amount of appointments. I just think they're able to show, like, if you've got Pfizer, Moderna, or Janssen and Johnson, and then you're able to put in a link where the public can click on to be directed to you. So if you were to link to your address, or not your address, your website, and then your website say, you know, we're only open 2 p.m. to whatever p.m., or we only have X amount of walk-ins, then you could put that on your website and just link it.
Okay, so if you're looking at filling appointments for vaccines, we've heard flyers, signs, you know, billboards, wherever you can get those visuals out. Make sure that you are in Vaccine Finder and you select that enable the location to be visible button. Continuing to work with your counties and call around to local businesses. Another thing that we've heard a lot from practices in the last few weeks is trying to reserve some time in each of those visits to have the discussion, because a lot of patients who are hesitant or are still gathering information are now in a place where they're able to do a little bit more research on their own and actually be able to think about whether they want to get the vaccine or not. So if you start having those discussions and then call those patients back in a few weeks after they've gotten their questions answered and maybe have changed their minds, to be able to schedule them back in. A lot of practices are starting to do Facebook Lives to answer questions. And we are kind of reaching a point where people are still hesitant, and some people haven't gotten the information that they need or their specific questions answered. So anything you can do or we can do to support you in overcoming hesitancy, please just let us know. Other practices are also partnering with local businesses to be able to help have them market the event, or local churches and things like that too. So anything else that you've heard kind of cool this week, Jen, on that?
Well, and there's making waiting lists of patients that you know might want it, so you can start making calls, trying to pull those out of your EMR. And then some of the ideas I think were great here to see if some of your neighboring COVID clinics have waiting lists that you can jump to. And I know that was a question a little bit earlier. Somebody was asking, like, what do you do with those end of the day doses, or there have been cancellations and you have some left over? Keep that waiting list and maybe do a partnership with your local pharmacy. Or if you've got a large FQHC near you, kind of ask them, can you share that end of the day waiting list? Maybe you can start calling back some of their patients as well. So maybe use a vaccine finder to find out who's your closest COVID buddy that you guys can kind of partner with on, just getting wait lists so we don't waste those doses especially.
Yeah, there's a couple questions coming in around that CDC vaccine finder too. I wonder if maybe we can dig out some additional information. I know, Angela, you're looking for things, but maybe reserve just 5 minutes to review that process in the beginning next week. We know it's a struggle. We've been hearing about it too, the CDC vaccine finder. We only have a couple minutes left, and a couple things that I hope that you all look at the chat too. I know some of us like looking at the chat while we're talking. Some of us can only prefer to just focus on the discussion and not read everything at the same time. So we will comb through that and look for other topics where you can start sharing ideas. I can see things around wait lists. That would probably be a good one. Not wasting doses. And maybe we'll hear somebody say, hey, I tried this last week and I was able to fill up my appointments. There is a question in there about how are you getting the data entered same day for events for over 200 people. This has come up quite a few times. I think that one thing that was helpful that we learned from many of our sites was that if you're doing over 75 to 100 people, you need a person that's their job. It sounds like the more we talk to people, if you don't want to hire more staff, you're only giving 20, 30 doses a day, maybe 50. And then you can get that ASIIS workload spread out into the existing staff. So it does take a lot of time. All right, so we have 1 minute left. We'll probably keep combing through the chats and answer some of these other questions. But want to make sure those of you who have patients starting at 1 can now wash your hands and run into the exam room. Next week, we are going to talk about talking with patients about COVID-19 vaccine. We're going to be joined by Donna Furlong, who, if you are an old Tappy friend, have seen her. She used to work in Coconino County and run the immunization program up there, and is super passionate about talking with patients about vaccine safety. So we're really excited to have Donna back. She currently is at Banner Health and down here in Phoenix. So So next week, it's going to be all about the crazy questions that you're getting, how to overcome them, and the normal questions that you're getting, and how to make sure that you get the right information to them. So we'll see you at 12 next Thursday, and we'll keep coming through the chat, Jen. Thanks, everybody.
Thank you. I'll keep trying to get the questions answered and we'll get them posted.
Yeah, I think that next week there's some questions too on here about ADHS, find a vaccine website. We need to like review all of those things, Jen, next week.
Yeah, I think that's a good idea.
Yeah.
You know, show the different programs that are out there and
Right.
who links to what. I think that's great.
And to help with our planning, Angela's already put most of the links in there, but
Oh, good.
yeah.
And if you two want to meet with me between now and then, I can tell you a few things I've learned about CDC Vaccine Finder, if that's helpful to you, if it's just an offer.
Very.
Yeah.
You know, kind of half answering these by what I can find on Google or what somebody else shares from a practice that's been doing it.
Yeah. For example, CDC has people set up when they very first log in to either have the organization as a whole submit for all facilities under them, or they can set it up to have the facilities input the inventory individually. So, you know, that when a lot of people ask questions, you know, you have to probe a little bit and first find out, okay, did you set it up as an organization or did you set it up so that each facility reports individually? And then kind of go from there. And then they have to choose whether or not they're going to manually put it in or whether or not they're going to upload it in a spreadsheet. So there's it makes it so that answers aren't one size fits all, I guess.
It makes sense that why it's working for some people and not others and why people are getting confused.
Yeah.
And Angela, maybe you can take this last one, these last two that are coming in, specific responsibilities for pods dealing with mass vaccinations. They currently upload received doses in ASIIS at this point, send temps, downloads every day. What else do they need to do?
So if you're so pods dealing with mass vaccinations. So one thing I've seen with some of the pods that are using VMS is they forget to receive the doses in ASIIS. So the day that you get the shipment, you need to log into ASIIS and mark the doses as received. That way, whenever you do upload the ASIIS file from VMS to ASIIS every day, that way the doses will actually decrement. You'd still need to report your inventory to CDC Vaccine Finder. With pods, you would just need to make sure you're following all the CDC requirements for off-site immunizations. That's all I can think of off the top of my head.
I know that this topic of how to run pods has come up a few times, and that might be worth revisiting, just kind of what everyone has learned for mass immunization events, maybe in 2 weeks or so, because I think there's even lessons that they've learned about how to set those up that are going to help those pediatric practices who might be doing similar kinds of things when Pfizer goes down to 12.
Yeah, I think so too. I think there's a lot of good lessons learned.
Yeah. More of like workflows and things like that.
Here's my go-to checklist for large pods. I'll put it in the chat.
All right. I love that idea around going to public spaces. I think some of for wasted doses. Rolling up to a park saying, come on down.
Yes.
One of the things that's interesting, especially as new folks have kind of entered our vaccine world, is, you know, knocking on doors is what we do at public health. So
Yeah, we usually have to go, we have to go find people.
Yeah,
Anyway, but,
under bridges.
rolling up to the park, find the ice cream guy, the ice cream van or the food truck that's in your neighborhood, and whoever's standing in line,
Mhm.
try to grab them.
Anything else that you
Hi, I had a question. I'm so sorry.
don't be?
So the question I had, so if a patient receives the first dose out of state, they cannot get it at our state, correct?
No, it might depend on your county, but yeah, pretty much I think all of them now they can still get it.
As long as they have their documentation, correct, or their card, so that we know which vaccine they received, right?
Yes.
Yeah.
And most states have a registry, so you can also, if they don't know, you can also call that other state registry and find it, track it down. But yeah, you can give it to them from out of state. In fact, my neighbor got his in Florida while taking care of his dad who had fallen. And he got his first one there, and he got his second one closer to home when he got back.
If they don't have the, where do we tell them to contact? How do they get in touch with those other state registries again? Do we have them go through ADHS, or do we just connect them to the right spot?
There's a link on the CDC's website, which I'll find that, you can quickly go to that state to get to their registry. But typically you just call the state health department of, wherever they came from. And they've usually got like an ASIIS help desk. They have, their version of it, and then you can call and get it from there. And that's just if the patient absolutely cannot figure out which brand they got.
Right.
Sorry, just chiming in really quick. So if they get one brand and they come out of state, can they get a different brand with us, or it has to be the same brand for the second dose as well?
It needs to be the same brand.
Thank you.
Yeah.
But and then the other thing is the interval. So this happened to another office a week or so ago, and that was one of the questions. They actually gave it 2 weeks early because the patient didn't tell them it was their second dose. They thought it was their first dose, but they had received their first dose out of state 2 weeks later, came in and got the second dose. The interval was too short, and Dr. Lewis officially said, do not give them a third dose. Even though the interval is off. And I'll ask her this week about if you revaccinate if they've been given the different brand, unless you know off the top of your head, Angela. I don't think you do.
You don't. Yeah. If there was an administration error, somebody gave a Pfizer and somebody gave a Moderna, 28 days later, you don't need to revaccinate that person. It is a complete series. Only for the Pfizer and the Moderna who use those similar technologies. Unless that changed, but last time we checked, that's what it was. But it is still an error, Anybody else? All righty. Well, we will see you all next week. We're going to talk about talking to patients. So have a good week, everybody. Thanks for everything you do.
Thank you. Bye.